Hi, my name is Paul and I'm from Nottingham in the UK. I'm 63 years old. I first started losing my hair when I was approximately 25 and it's been receding ever since. I researched a lot of clinics both in the UK and then in Turkey. And I'm quite a private person, so I wanted the clinic to be just a one patient a day where the doctor does all the procedure or the most of the procedure. So I did my research on the internet. There's hair loss in my family, hereditary. From my brother lost his hair, my father's hasn't got a lot of hair, so I knew that my hair would probably be the same. Like I said, I did a lot of research on the internet, both in the UK and in Turkey. I was seeing better results in Turkey from various doctors as opposed to the UK, which swayed me more towards Turkey than the UK. And then I started looking on the American Board of Hair Restoration Surgeons and also the International Society of Hair Restoration Surgeons. Look for doctors on them two websites. I scaled it down to probably 3 doctors that was on both of them websites and ultimately chose Dr. Sahinoglu for my surgery because, like I say, he does one patient a day, does most of the procedures himself, also from the results that he got from them procedures. So I did an online consultation with various surgeons in Turkey, where you send in your photographs, they look at your hairline and send back what they think would be the best for you and how many grafts would be involved. And then you decide a date that you want to come to Turkey. The hotel's all sorted for you. Travel from the airport to the hotel, from the hotel to the surgery, and vice versa is all accounted for. The only thing you have to sort out yourself is to arrange your own air passage to get over here. And I went with Turkish Airlines. Like I said, I did a lot of research and found them to be one of the best for me from Manchester. So it was decided by Dr. Sahinoglu 2 sessions. The first session being the front part of the hair, and then if I was happy with what happened there, a year later approximately, he'd do the back part of the hairline. This is so they can calculate how many grafts is taken in the first sitting so they don't over-harvest the area. So then you send photographs approximately 6 months after the surgery so the doctor can decide then whether it's you've got enough donor area to actually do any more surgery on the parts that you need doing. The procedure itself, it was a piece of cake really. You're picked up from the airport, from the hotel, like I say. You're brought to the surgery. Dr. Sahinoglu does an initial assessment of your donor area, takes some photographs, draws the hairline that you're happy with, and in my case it was like age related. Like I say, I'm 63 years old, and it's to, for my age, I didn't want to like the hairline of a teenager, so it is age related, and he does emphasise this when he's doing the drawing the hairline. And so the procedure itself, you're given a tablet just to relax you. You're happy with what the doctor's drawn for your hairline, and then the doctor shaves your head, and then he's make sure you're happy, and then he starts doing the anaesthetic, which I must admit the first 2 or 3 was quite painful, not overly painful, but a bit of a pinch. And then once the anaesthetic kicks in, then the rest of it is, it's just like somebody placing something on your head really, just there's no pain. And I was quite relaxed from the tablet anyway. In fact, during the procedure I fell asleep. Dr. Sahinoglu then starts the extractions, which feels like a small drill. No pain, just like a small drill noise to extract the follicles. I think we had a break then. We stopped for a break. I had a little chat with the doctor and made sure I was relaxed, that everything was going okay. A short break, like I say, and then the doctor makes the slits where the follicles are going, which takes a couple of hours. Then he starts with the inserting the follicles into the slits himself around the front part of the area to get the hairline that he's happy with. And then for the middle part, or the crown, or the front of the crown, the two nurses take over to fill in the rest of it. Everything was explained along the way, you know. I was constantly asked if I was okay, if everything was all right, if I feel any pain, and it's as clean as anything. They're constantly wiping your head with saline solution to keep everything clean and no infections, which I think was very, very good. I forgot to add earlier that I had 4 different online consultations with various doctors in Turkey. And there's one doctor that refused, saying that I was too far gone to do any surgery whatsoever. And he was one of the more prominent doctors that you'll find on various websites. Right, after the surgery, the doctor explains what's going to happen, where you know you shed the follicles after 7 to 14 days, which I already knew about anyway. Like I say, I've done a lot of research into hair transplant surgeries. Like I say, after 14 days the hair falls out, and then it's like a fairly long wait to see any results that you're really happy with. And mine took from probably 4 months to where I am now, which is a year later. I've got the hair that I've got now. So it's a long process. It's not an overnight thing. And like I say, I'm 63 years old, and I just want to let people know that it's never too late to do anything about it, because the older you get, the less the hair loss slows down to where it's not going to get any worse. So you know the full extent of your hair loss, whereas when you're a lot younger, you don't really know how much balding in your life is going to take place. So you could have a little bit of hair loss, or you could have a lot of hair loss. And a lot of younger people, in my opinion, are taking far too many follicles out, not safeguarding the donor area for the future hair loss. But that's only my personal opinion. I'm very happy with what Dr. Sahinoglu's done. I've got nothing on my hair. I had a shower this morning, and it's just shampoo in my hair. There's nothing in it that, to enhance the hair. It's just shampoo. So when I had my first procedure, it was just to, like I say, to do the front of the hairline. It frames your face, I've been told, and that's what people see. Just, a lot of people don't notice too much of the back part, just to frame your face. And like I say, on the first procedure, the doctor said that he'll just do the front part when he sees the photographs from 4 months onwards, to see if it was either necessary or viable to do a second procedure. So that's why I'm here, to get the crown part of my hair done. I'm quite happy with the front, but I'm going to leave it in the doctor's good hands. I think he's done a good job up to now. I'm very happy with what he's done. I just want people to know, because you might be thinking that I'm getting some benefit from making this video, or getting a cash payment for making this video, but I can assure you that I'm doing it on the grounds of to promote the doctor, because I think he's a very good doctor. People of my age that are in two minds whether to have a surgery done at all. When I had my first procedure done, I said to the doctor, I must be one of the oldest patients you've had, being 63. And he says, no, he says, there was a local man, he had it done when he was 85, which, seems unbelievable to me, but he said he was quite happy, he did it, he was happy with his results. So, like I say, it's never too late to have your hair transplanted. If it makes you feel better, like it does me, it makes me more confident, and if it's going to do the same for you, then just do it. And I'm one of these people that I hate flying with a passion. And like I say, I flew from Manchester. It takes 4 hours to get here. I've got 4 hours flight back, and this is the second time I'm here. So it's just a testament to what the doctor and his team does at this particular surgery. So this is my hairline now. From this is approximately 12 months since the surgery. If you can see, I still need the mid-scalp doing, which I'm here to do today. I'm quite happy with the front. I'll just let you see now how it looks. And I'm quite happy with the way things are at the moment.